hepatitis A, also known as infectious hepatitis, is an acute infection of the liver caused by the hepatitis A virus. Signs and symptoms. The symptoms of hepatitis A are fever, generalized aches and pains, nausea, lack of appetite and abdominal discomfort. Dark urine is usually the first specific sign of acute hepatitis A, followed a day or two later by jaundice, yellow skin and eyes, and pale-colored bowel motions. The severity and duration of the illness varies, however, most people feel better by the third week. The disease is usually more serious in adults than in children. In adults, hepatitis A occasionally presents as a serious, disabling disease lasting several months. Treatment. There is no specific treatment for hepatitis A. Management of people infected with the virus is aimed at treating the symptoms of the infection. People with hepatitis A are sometimes sick enough to be admitted to hospital, although this is rare. Transmission. The virus is usually spread when feces from an infected person contaminates something which is transferred to another person's mouth. The virus can be passed on by food that has been handled by or shared with an infected person, drinking contaminated water, hands after touching infected feces, nappies, linen and towels, and oral or anal sex. The virus can survive in a dried form at room temperature for several weeks and in water for longer periods. It usually takes about 28 to 30 days from contact with the virus until a person starts to feel unwell. However, it can take up to 50 days. Infected people can pass on the virus to others from about 2 weeks before and up to 1 week after the appearance of dark urine or jaundice. Some people, especially small children, may not show any symptoms even though they may have the virus and can pass it on to others. Prevention. People with hepatitis A should not return to work, school or childcare until they are no longer infectious, which is at least 7 days after the onset of jaundice. Hand washing and good hygiene practices are essential and are the most effective ways of reducing the spread of hepatitis A infection. Hands should be washed thoroughly in soap and water for at least 15 seconds and then dried thoroughly. It is important to wash hands after going to the toilet, touching soiled linen or articles, and before preparing or eating food. Close contacts of an infectious person may need vaccination. This may prevent illness if given within 2 weeks of contact with the infectious person. Contacts who need vaccination generally include household members, sexual partners, other people in the same childcare group or preschool classroom, and anyone who has eaten uncooked food prepared by the infected person. Health outcome. There are usually no long-term effects as a direct result of hepatitis A infection. Unlike hepatitis B or C, people cannot become chronic carriers of hepatitis A virus. Complications of hepatitis A are uncommon, but on rare occasions can include liver failure resulting in death. Please subscribe to our channel and give this video thumbs up. Share this video with your friends on Facebook and Twitter. Thanks for watching.